I am here once again this week with epidemiologist Bonny Specker, who is going to give us an update on the COVID-19 situation across the state, in our area, across the nation, and in the world. Bonny, what do you have for us today?
Thanks, Chelsea. I thought I would talk a little bit about what's happening with the Omicron and then also cases, hospitalizations, and deaths by vaccination status and how that's going to impact the hospitals, especially with influenza. And we also have some updated state mortality data for 2021. So one thing I wanted to just mention to start with is what's happening nationally. And what we see here, this is the most recent. I downloaded this. This is through January 3rd. And what I wanted to point out here is that this very large increase, this is probably due to Omicron, or not probably, is due to Omicron being so highly contagious. But this big increase began around December 21st in the number of cases. And test positivity since the beginning of the pandemic, it's way up right now. We want that typically to be less than 5%. And when I downloaded this, the most recent data was close to 22%. So very high. And that's saying of people that are being tested, what percent of them end up being positive? And this is kind of difficult to interpret because of all those at-home tests. If you end up being positive at home, you might go into the clinic to confirm it. But if you're negative, you won't go into the clinic. So the clinic is, the tests that are being reported could be more likely be positive, if that makes sense, because those at-home tests aren't reported anywhere. So the negatives are kind of falling out. But the thing that I think is important, I had just said the cases, that peak really started going up on December 21st. And usually you see an increase in hospitalizations about a 1 week after a case is diagnosed, 7 to 10 days usually. And we actually see that in the national data. This big increase in hospitalizations did occur around December 28th. So 1 week after that big increase in the number of cases, we're seeing a big increase in the number of hospitalizations. Now, people are saying, well, Omicron isn't as bad, and we don't think it is, but they're saying, well, we haven't seen the deaths go up. But you really wouldn't expect to see those going up just yet, because the deaths typically occur about 1 week after hospitalizations. And that's just like now is when those deaths would be going up. And so they haven't been recorded yet. So this will be an important thing to follow with Omicron to see if the deaths increase similar to the hospitalizations or whether it can stay down. And one of the things I wanted to talk about was vaccination. These data are from the CDC, and this is from October and November. So this is during the Delta period, the Delta variant. And what we're seeing is a higher rate of positive cases among unvaccinated people compared to, this is fully vaccinated without a booster, and this is fully vaccinated with a booster. So you can see here a definite benefit of vaccination. And in October, unvaccinated people had 10 times the risk of testing positive for COVID and 20 times the risk of dying from COVID compared to fully vaccinated people with additional or booster doses. So, that's showing a benefit of having the vaccine and the boosters on developing COVID. Now, the CDC doesn't have data on vaccination status by hospitalization, and New York City does keep this data, and you can see the same trend. This is the rate of hospitalizations among unvaccinated people. This is orange line down here is the vaccinated, very large difference with a much greater increase in hospitalizations among unvaccinated. This center line is just overall what the city is seeing. And back to the CDC data, they do have this data, the death data by vaccination status. And you can see that unvaccinated people have a higher rate of death than the vaccinated people. And you don't see a big effect here between fully vaccinated with booster and without booster, probably because the deaths are so small to start with. So the vaccine is protecting against death, but again, this was the Delta variant. We aren't sure what's going on right now with Omicron. If we look at vaccination status for South Dakota, 57% of the state's entire population is fully vaccinated. That compares to 62% nationally. And only 19% of the state's population has actually received a booster. And that's 34% of fully vaccinated people. In Brookings County, it's 49% of the entire population is fully vaccinated. So we actually have low vaccination rates here in South Dakota, and it's likely that this is going to result in a higher number of hospitalizations. And this is coming at a bad time. South Dakota is in the middle of the flu season. Normally, the flu season peaks in February, right in this area. And this is the current year. Each of these lines represents a previous year. And you can see that the flu season has started quite early, and the number of cases are increasing quite dramatically. So if it peaks, we're going to be up into the thousands. Well, we already are in the thousands, but it will be, this is indicating it's going to be a bad flu season. As far as deaths, the Department of Health did update the mortality data, and they've added deaths for the month of October in 2021. And just a reminder, all of the 2021 data is provisional. They finalize that data at the end of the year. And these are just some calculations. If you look at 2020, and this is finalized data, there were a total of 9,857 deaths. And the average number of deaths per year in South Dakota is 7,602. That's between 2010 and 2019. And the difference, if I subtract this from the total that we saw in 2020, it gives us 2,255 excess deaths. And if people, if they're interested in what excess deaths is, they can go back to one of our previous videos where we talked about it. But that would be the number of excess deaths. In 2020, it was only recorded about 1,500 deaths. So there were a lot more deaths observed than could be explained by COVID. And we've talked about this before, as possibly being people not going in for health care when they should have gone in, or the healthcare systems being overwhelmed and not being able to treat people that need to be treated. So that was in 2020. Right now in 2021, there have been 7,398 deaths. Typically what the average number of deaths through October from 2010 to 2019 is 6,397. So the difference between these observed and the average is 1,001. And if you add this to this up here, you get an excess death of over 3,000 during the last 2 years. So just to remind people about what excess deaths are and what we're seeing there. Now, as far as the data for this past week, just to note, there are over 12,000 active cases of COVID right now in South Dakota, and that translates to 1 out of 70 South Dakotans who are currently sick with COVID. So even if people are having milder cases and just feeling bad, these people aren't going to be in work. So a lot of industries, a lot of work is going to be limited. So just to keep that in mind when you're, out and upset because you can't get something or something's closed, it could be because of this outbreak. Now, if you look at Brookings, we had a huge increase, more than doubling of the number of cases last week. Um, Before last week, we had 87 cases per week. And then last week, as of yesterday, we had 223 cases. So you can see we're getting close to where we were in November of 2020 at the peak outbreak. And if you look at the age distribution of these new cases, 19% of them were less than 20 years of age. 50% were between 20 and 39. This happens to be the age group that has the lowest rate of vaccination, which could explain why there's such a high percent of the cases right now. 22% in that 40 to 59 year age group, and 9% in 60 years and older. So we are definitely in a situation of high community spread. If you look at test positivity, and just for people who don't see these slides very often, I had to change a lot of the axes because of the numbers this week. This is one of them that I had to change. We have never had a test positivity rate this high. And again, I'm not sure how much the in-home testing is contributing to this, but the CDC does use test positivity to define level of community spread, and we're definitely well above the 10% that's used as a cutoff for high spread. Hospitalization data. The hospitalizations total throughout the pandemic have been 177 among Brookings residents. Last week, we only had one hospitalization, so that's a good sign. The week before, there were 3. This may be a good sign, but again, we're just now seeing the cases increase, so we wouldn't expect hospitalizations to increase for another week. And then the hospitalization data is also delayed by about a week. So it may be 1 or 2 weeks before the dashboard data actually, indicate an increase, if in fact there's an increase. We haven't had a death for quite a few weeks now, and overall there have been 41 of our county residents that have died from COVID. If you look at the state, it's following pretty much Brookings is following what's happening in the state. More than double the number of cases this past week. And you can see the age distribution statewide. It's also high in the 20 to 39 year age group. So we're getting a large increase here, similar to what we saw back in November of 2020. Hospitalizations, or one of the things I wanted to mention about the number of cases. This is the number of cases per 100,000 population for the counties with the 10 largest cities. And Brookings is this solid yellow line. We've been kind of on the lower end of these 10 counties until this past week. We're now jumping up to the 3rd highest. This is Minnehaha. So there's a major outbreak here. This was actually where Omicron was first detected. So they might be a little bit ahead of everyone in that. Yankton County also had a fairly big increase. And then Brookings, all of them are increasing except Davison. Its increase wasn't as dramatic as all the rest of the counties. So pretty much this increase that Brookings is seeing is being seen in many of the counties across the state. Hospitalization data statewide. On yesterday, there were 287 people in the state that were hospitalized. 77 of them were in the ICU. This compares to 237 the week before, with 76 in the ICU. The total admissions have been over 9,000. There were 105 new admissions last week compared to 108 the week before. So this yellow line is the number in the ICU using this axis here on the right. The blue line is the number that's currently hospitalized, and that's using the axis over here on the left. And this light purplish bar is the number of new admissions. Most of the hospitalizations this past week have been in the older individuals age 60 and up, but we have had some in the less than 20-year age group. If you look at deaths, there have been over 2,500 deaths from COVID. Last week there were 33 compared to 24 the week before. And just a reminder that the average number of deaths from flu each year over the last 10 years has been 34. So we reached that annual total in just last week in terms of COVID. 2 of those deaths were among 20 to 39-year-olds. 8 of them were between 40 and 59, and 23 of them were 60 years and older. And you know what we're seeing state and locally, you're seeing nationally. We had a very large increase, again, more than doubling of cases diagnosed in the past week. Nationally, we were at close to 3.9 million new cases in the US. Deaths were dropped a little bit here, and hopefully it will continue to not increase, but we'll see in a couple weeks what happens. Globally, the Omicron is hitting a lot of countries, and there was also a doubling of the number of new cases, worldwide, as this Omicron is spreading throughout the globe. And as with the United States, they have not yet seen an increase in the number of deaths as a result of this new variant. It was just a slight increase. So that's about it for this week. I just want people to remember that healthcare workers really are stressed right now. They're seeing a lot of patients. And if it's a good time to thank these healthcare workers, if you know anyone that's working in the healthcare industry, thank them now and all winter, because it is going to be a pretty hectic winter for them. So support them the best you can. That's all for this week.
Well, thank you, Bonnie. Now, I want to remind individuals, if you do have a question for Bonnie, please email us at the email address listed in the description of this video, and we will make sure to try to get those questions answered for you. And thank you for watching. We'll be coming up with a new video in a month. But reminder, these slides are updated weekly on the City of Brookings website under the COVID tab. Have a great week.